Hi, and welcome to the Lympha Press Educational Webinar Series. We are delighted to bring to you very pertinent content today with two excellent presenters. Our subject, the top 5 benefits vascular edema patients receive from telehealth physical therapy. And as you are logging on, feel free to say hello in the chat. Let us know where you're from. We're delighted that you took out time from your busy days to be here with us today. We also encourage questions and answers. So please feel free to put them in the Q&A, and at the end of the presentation, we will get to them. This is being recorded. Everybody always asks that question because sometimes the content is so rich, it's like you can't get it all live. So you will be privy to the replay. Everybody who has registered will receive a copy of the replay of this webinar. I am Brenda Viola. I'm proud to represent Lympha Press today, and I'm also proud to introduce our speakers. Karen Ashforth has practiced as an occupational therapist, and every time I read this, I want to choke on it, Karen, for over 40 years. Feels like impossible, and yet your breadth of knowledge and wisdom is evident every time you speak. You have many accolades. You speak internationally. You are published. You are also an adjunct faculty member at the University of the Pacific in the Doctoral Physical Therapy Program. There's so much more I could say, but Karen, welcome. So glad to have you here today. And then Gretchen Walsh, we're so honored to have you with us today, a licensed physical therapist who received her Master's of Science in Physical Therapy from Grand Valley State University in the early 2000s, and her Doctor of Physical Therapy at the University of St. Augustine for Health Services in 2011. Your expertise, Gretchen, we are so proud to have on our platform today: outpatient, acute care, inpatient rehab, home health, skilled nursing facilities, the list goes on. But without further ado, I'm going to disappear and yield the floor to our tag teaming presenters today, Karen Ashforth and Gretchen Walsh. Thank you for being here, and take it away.
Thank you so much, Brenda. So we wanted to begin this presentation with just touching on what is telehealth in the therapy space. So we still are doing our examination, our evaluation, we're providing that treatment, thinking of it somewhat similar to the in-clinic atmosphere. Obviously, we're not having our hands on the patient, but we're doing this very effectively using an online software platform. And then from there, we can utilize a home exercise program that we provide digitally. And this just allows for the patient to be able to access any education content we have, be able to touch on all their exercises and improve their compliance in between visits as well. And then our particular platform we use with the brand that I work for, which is Agile Virtual Physical Therapy, we also have the ability to do some remote monitoring in between visits. And that really enhances the experience for both the patients and helps with the effectiveness from the therapist perspective. So with that, we're able to look at pain levels in between visits, any difficulty with exercises or their daily activities, exercise compliance and adherence in general. And from the communication side, I think that sometimes is thought of as a potential barrier in telehealth between the patient and the therapist, but I'll really tell you, we find that that isn't usually the case. And, through our patient messaging and our other offerings that we have as touch points, it's a very similar experience and a buy-in or that bonding experience too between the patient and the therapist as well. And then for our particular brand for telehealth, we also have a care coordinator, and they're really the individual that quarterbacks the whole experience for the patient. And that is anything from the online scheduling piece to tech support too, because we know not everyone is going to be really savvy with telehealth or perhaps experienced it before, and we want to make sure they feel comfortable prior to any visit. So as far as beliefs go in telehealth, we know it's not going away. So a recent study that was from 2020 to 2021 is really showing that patients are choosing telehealth. As you can see, 60% of those out of the convenience of it, and 55% are even just as much satisfied, if not more, with telehealth than they are in-person care, actually. And we know additionally that at least 40% are willing to continue to utilize telehealth even after the pandemic. And not just looking at telehealth only, but looking at digital health solutions in general. So this would include online scheduling, sort of a virtual triaging or screening appointments, that sort of thing. That 63% of those that were surveyed are open to any of those type of digital health solutions as well. So outlook for telehealth, yes, it expanded exponentially, during the early COVID years. But we know now, even just based on a survey, for example, with this AARP, that 56% of those that are 50 to 64, they have used telehealth, and even 46% of 65 plus. And that's a big shift. We're seeing, only 11% in 2019 were using telehealth, but we're seeing now with those surveyed that up to 76% are interested in using telehealth moving forward. So a really large percentage, and we're seeing high satisfaction. 74% of those, surveyed are having high satisfaction as well with the telehealth. So it's here to stay. So these are some stats from a utilization study that we did as part of our virtual therapy brand, so the Agile Virtual Physical Therapy. And this was done about 5,000 visits from 2020 to early 2022. And I really want to highlight this because it shows the wide variety in age groups that are utilizing telehealth services. So we may think, oh, it's technology, it's going to be more of those 50 and younger, but really, as you can see with the stats, the 50 plus group was actually over 50% of who's coming to us for physical therapy. A really high percentage of female patients, interestingly enough. And then of those that we did dive into, 83% were reporting improvements after their physical therapy episode of care that was done virtually. So good outcomes as well.
So I'd like to talk from a practical experience that I've had over the past almost 3 years with telehealth. But even prior to that, I have had over 10 years of doing phone consultation and troubleshooting with patients. So there are a lot of skills that can be utilized when we're not in person with the patient to be able to determine the problems and the solutions. And what happened for me 3 years ago is with COVID, my outpatient lymphedema clinic shut down completely for several months due to the pandemic. And I was encouraged to continue patient care with telehealth and home visits. And I have enjoyed it so much that I currently own a telehealth private practice that is active, working with lymphedema patients. And I feel that there are some patients that absolutely would benefit more from the hands-on, but there are many other patients who are appropriate for telehealth. And there really is an environment, that the home environment advantage in terms of patients being able to really, be honest about what's going on for them and what they're willing to do and what they're able to do. Being in their home opens up that honesty, I feel. And no doubt, complex cases absolutely require a referral to a specialized clinic. However, I see many patients in my private practice who are seeking lymphedema care One gentleman was on a waiting list for 3 months for a lymphedema clinic, and he had urgent needs that we were able to meet, and he noticed changes within hours of our session. So this is an example of how we can really bridge the gap for patients who are on waiting lists for in-person care that may need in-person care, but are able to receive intervention in the meantime. And then for other patients, they're able to really get what they need from the telehealth environment.
So when it comes to benefits, absolutely, telehealth is cost effective and convenient. It comes back to the scheduling. It's very easy. There's no travel involved, no concern of, do I have to, find babysitters for my children? Do I have to find a driver or a caregiver to attend appointments with me? That quick and easy factor is amazing. And then affordability is also something to really think about as far as a benefit from telehealth. So another case study that we did when we compared in clinic to the telehealth, a match set, it really found over an episode of care for physical therapy that there was a 47% reduction in cost for that episode of care. And some of that was due to a less overall length of care, and then also the number of total visits was less as well for telehealth. So the affordability piece is certainly there from both an insurance perspective and then the patient as well. Insurance coverage also, since the pandemic, has been great. All major insurances are covering telehealth, and at least for the foreseeable future, that will continue as well. And then, as Karen already touched on, really expanding access. For those that sometimes therapy services in general for rural communities is challenging enough to staff. But then when you add a specialty on top of that, incredibly difficult. And so for them to be able to, a patient to be able to access care quickly, it is really a game changer for them. So successful outcomes is something else that I really want to address as far as benefits to physical therapy. As I mentioned, the study that we did comparing in-person to telehealth, we looked at 86 patients with this and did age match and some other variables as well. And the great news is based on our research, we found that 98% of those telehealth patients had functional improvements, and also 93% saw pain improvements. And then we use, it's called the Net Promoter Score, and that NPS scoring is our patient satisfaction scoring. And that total would be out of 100, and anything 70 or above is actually considered world class. And ours were 90, which is amazing, and that's consistent with our in-clinic as well. And then the visits overall, 32% less than in person. From a scheduling perspective, we were able to get patients in for telehealth visits 60% faster. So if it was 5-day wait, for example, in person, it was only 2-day for telehealth, as an example. And then, as I already mentioned, the cost reduction. And then from an actual telehealth platform itself, our software system that we used, our patients rated that a 4.5 out of 5. So quite satisfied in general. And then I want to touch on quality care because I think this is something that at times the society thinks that telehealth is subpar to in-person care, and it's not for every individual, absolutely not. But as a whole, it really is a top-notch quality care experience. For our brand, we're seeing patients one-on-one. It's with a licensed doctor of physical therapy only. We're not using health coaches or even physical therapy assistants, actually. A full hour for an evaluation, and all our follow-ups are, spending very good quality time from the therapist and patient perspective. And then our patients are staying engaged. We are teaching our patients to care for themselves and reduce that dependency that sometimes can occur within clinic. Sometimes while manual therapy is great, it can sometimes support a dependent relationship. And so, we don't have that as an option in telehealth, but that can be quite empowering for patients as well. And then I already touched on this a little bit, but that digital health experience really can be quite helpful as well. That remote monitoring and the home exercise program app can really help with patient adherence and then ultimately outcomes.
So as I mentioned before, and by the way, I have done many years of home health as well as outpatient clinic. And my experience is when the patient is in their home environment, that's where the rubber really hits the road. The patients can come in and talk a good story, but when they're at home, that's their kingdom. And I find patients to be more honest about their challenges, as well as their ability to be compliant. And it allows for more success because we can really deal with what's there and what's real. The other big advantage is being able to assess the home environment. So virtually, we can look at every aspect of the home from the shower to the bedroom. Patients can really show us where we can't see this when we're in an outpatient environment. We can see what the barriers are and address them directly. We can also involve family members more because they're in the home environment, and we can work with caregivers and people who are involved in the patient's care. And we can definitely make recommendations for referral to other services. We can maybe get more of a glimmer of a need for mental health. We can do referrals to wound care, make these recommendations to the medical provider as is needed by the patient. Patients can really get specialized lymphedema education. And as I mentioned before in my story about the gentleman who was on a 3-month waiting list, I was able to give him some very valuable education that allowed him to be able to turn around his condition. In his case, it was a very severe case of genital edema, and he had gone online and looked for manual lymphatic drainage resources and had gotten some very generic information that was taking him a long time to perform and was totally ineffective. And I was able to, in some very short time, give him exactly what he needed to turn around the genital edema that was really creating a lot of suffering for him. And in addition to specific techniques, we can give patients a real understanding about what lymphedema is, how venous disease creates problems, and look at the compliance in the home program, as well as provide a lot of troubleshooting and problem solving during treatment, and establish healthy habits to decrease and prevent symptom progression. So you may ask, who can benefit from telehealth therapy? And as we've both said, not all vascular patients are able to manage their lymphedema symptoms, and stockings cannot necessarily be the end-all answer for everyone. So patients who have profound damage, either due to fibrosis, surgery, radiation, trauma, maybe even prior cellulitis incidents, patients who have decreased range of motion, strength, dexterity, and pain. Using compression garments is not necessarily an easy thing. And so we have lots of alternative garments that we can recommend. Patients who have poor caregiver support, maybe they live by themselves, and that is an ideal patient for telehealth intervention. and patients who really need self-care education, because education is really the backbone of telehealth treatment. It's empowering patients, as Gretchen mentioned, to not be dependent on the outpatient therapy center, but really being able to understand and learn for themselves how they can treat themselves and keep themselves healthy. So what do patients receive? They receive a specialized lymphedema assessment and treatment. They receive a functional assessment for mobility, gait, strength, and safety. They receive specific education about lymphatic and venous disease process, and a specialized home program with conservative treatment, which includes compression garments, positioning, exercise, and home pneumatic compression if appropriate. Home pneumatic compression can provide both decongestion and compression. It's evidence-based to prevent cellulitis and wounds. It's very easy for patients to use with a high compliance rate, and it's proven to reduce healthcare costs overall. So patients who are not appropriate for telehealth need to be referred to advanced lymphedema treatment in clinic, and this would include breast cancer or other cancer-related lymphedema patients, patients with lipedema, patients with stage 3 lymphedema, patients who have wounds or severe fibrosis, or the need for a complex decongestion compression program. And I'd like to just share an example of a patient that did a lot of home-based treatment that was very successful in reducing her problems. This is a patient that had very difficult mobility. She could not get in and out of bed by herself. She couldn't get on and off the toilet by herself. And she required the use of both her husband and her granddaughter to lift her leg because of the large amount of swelling and fibrosis that she had. And after treatment, she was able to do all of these things independently and was definitely a happy camper. So this is the end of our formal presentation. I'm going to go ahead and stop sharing and invite questions. If anyone here has anything, if you have any experiences to share with telehealth, or if you've never experienced it and are just curious about it, we're here to answer any questions you might have.
So I will jump in because I had my first experience with telehealth when I got COVID. It was my Christmas present. So much fun, right? And I was shocked at how easy it was to use. But what would you say are the challenges for the patients and for the clinicians in terms of leaping over that hurdle? Because once I did it, I was sold.
Yeah,
Wow.
I really think that for some, definitely the technology piece of it, they think, how am I going to do this? What, do I have the right equipment? All those things. That's one of the reasons why we utilize even a care coordinator, because they can get on with the patient ahead of time. There's sort of waiting room areas where they can test things. We do send a pretty extensive email ahead of time too. That's usually about 24 hours ahead of time. And it really lays out sort of how to have that best experience. So, what to wear, how to prepare, even, hey, have you updated your, whatever you're using as far as Google or, your iOS, some of these things that sometimes you forget about or, delay and think, oh, what do I need that for? So it's just those kind of things that really can help with success early on, I think. And it's funny because I feel like that barrier initially, that initial 5-10 minutes sometimes feels awkward. And then all of a sudden you're like, you just forget that it's, and I think so many people too with the pandemic or even prior with FaceTime and, all of these other offerings now are more used to that video experience. And so I think, that kind of melts away awful quick.
Thank you for that answer. Did you want to add anything to that, Karen?
Well, I just feel that I love doing telehealth, and I can create that feeling of intimacy and that trust that happens in the clinic virtually. And it's so easy now. It's something that I think that people who practice telehealth and are skilled in telehealth, you just learn the skills of being able to communicate well and connect well, even virtually. So I feel that it's amazing. I mean, I'm talking with people all over the world every day, and it's exciting to me to be able to help people that just aren't getting help any other way. I make a lot of referrals to lymphedema clinic. That's probably the bulk of what I do, but I also have patients that continue to see me because I'm meeting their needs, and they are wanting to have this service because it's working for them to work with me virtually rather than to go into a clinic. So it's exciting that we have this option, and COVID has really been a bummer, but this has been the silver lining of COVID, is that it's brought the world together virtually, and that we have so much more in terms of treatment and education like we're doing today.
Yeah.
I mean, it's amazing.
Here we are. And we love Gretchen, did you want to jump in and say something to that?
Well, the only other thing I was going to mention is the privacy factor. Sometimes there's that concern too. So I did want to mention that, the software platform that we use, for example, is HIPAA compliant. There's no concerns about, we're not recording and sending to anyone, there's nothing along those lines. So we have to have the same standard laws that we would for in-clinic as well.
I have personal experience aside from myself. My mother was in assisted living when COVID hit. And prior to COVID, it was really difficult to transport her to her doctor's visits, to schlep her rollator, get it out of the trunk of the car, go into the building, go up to where her appointment was. My mom had COPD, so she would gasp for breath trying to get into that appointment. And then, like you said, Karen, silver linings, she was able to do telehealth, get the appointments that she needed from the comfort of her own little apartment. And the caregivers at the assisted living facility helped her with the technology aspect. So there is truly such a benefit. And you gave us more than 5. You just said the top 5, but we got more than we bargained for today. I want to mention a couple things and then give you each a chance to close out with any final thoughts. We do have an ongoing series of webinars here at Lympha Press. We're so honored to continue important conversations with thought leaders. Paula Donahue is going to be presenting for us coming up on first aid for lymphedema patients. And you can just follow our link tree on Lympha Press, the Lympha Press website, lymphapress.com, to register for any of those events. And we have a research roundtable for clinicians. It's the first Monday of every month at Eastern time. It's 7 p.m. Eastern time, Pacific Standard Time, 4 p.m. And I also put that link to register in chat. We'll also send that out to everyone who receives the replay. So, final words for our audience. Would you like to go first, Gretchen?
Sure. Yeah, I think just if you haven't tried telehealth, I really encourage you to do so. And the expanded access and the convenience of it can't be denied. And I think it's just a really great offering that we'll see for many moons to come.
Excellent. We really appreciate you being here today with us.
Absolutely.
And you'll have to come back. And Karen Ashforth, take it away and close it out.
Well, You mentioned privacy a few minutes ago, and it occurs to me that there are a number of lymphedema clinics that don't have private rooms, and patients are seen in a gym with curtains around them. And telehealth really gives patients the ability to have truly private treatment. There's a real sense, I think, of comfort in being able to have that, one-on-one relationship where it's just whoever you want to be there with you in your home environment plus a therapist. So I guess that's maybe reason number 6 or 7 or however many we've gotten up to.
Yeah, I think
So
we might be up to 10 right now.
that popped into my head.
I appreciate you raising that, and it's a great way to end this webinar. We thank you both for presenting today. You're an amazing tag team. And to our audience, thank you for joining us, taking time out of your busy day. We know many people will also watch this on the replay. Continue to stay tuned. Lympha Press is always bringing outstanding content to both patients and clinicians. And with that, have a wonderful day, everyone. Bye-bye.
Thank you.